So here's a case in which you can use it as a teaching situation. And normally, we don't think about the adrenal as being something that we teach readily by ultrasound. And especially in many patients, it's difficult to see the adrenal. However, on CT, you can virtually always see the adrenal. So if you can use, again, here's the CT of the same patient with the ultrasound. If you have the CT next to the ultrasound, you can then show the resident side by side, here's the IVC, here's the adrenal, here is the diaphragmatic slip, same thing, IVC, adrenal, diaphragmatic slip, and it's a great teaching tool. This was a clinical problem in which ultrasound co-registration really helped. And what happened was this patient was sent to ultrasound to characterize this hyperdense CT cyst. Well, unfortunately, the patient was sent into a room initially without co-registration, and so the sonographer thought he had the cyst, and it turns out he didn't. I mean, you could tell obviously that it wasn't the right location because it turned out this was the only cystic mass in the inferior pole, and he was actually looking at something in the upper pole. And so I had him go back into a room with ultrasound co-registration and rescan, and he was able then to find the correct cyst and document the fact that yes, in fact, it was a cystic lesion and it was in the same location as the hyperdense cyst. Here is another situation. 63-year-old woman with hematuria, another hyperdense cyst. Again, this is to show how fusion is useful for cross-correlation. You notice if you have these pictures as part of your documentation, it's no problem. Any clinician, anybody can look at it and say, oh yeah, of course, you looked at the correct cyst because the orientation of the CT and the ultrasound is the same, and you see that the simple cyst with the through transmission matches the hyperdense cyst on CT. Here's another case. 64-year-old woman with intrapapillary mucinous neoplasm. And this is a situation to show that, you know what, you don't have to have beautiful pictures to make a point. And so in this particular case, my sonographer came to me and said, you know what, I can't find the CT lesion because it was such a small lesion, it's this thing here on CT, that they were asking us to take a look at it to tell whether or not it was cystic or solid, and she couldn't find it. So I went into the room, and again, I can't spend a lot of time looking for these lesions. I used ultrasound co-registration, and I quickly started scanning, and I immediately found this hyperechoic area, which matched this CT lesion. So I could definitely say, yeah, it looks like an angiomyolipoma. So in this woman who had a neoplasm elsewhere, it turns out there was an incidental angiomyolipoma in the kidney. And these aren't beautiful pictures, but it's okay. It proves the point, and that's what you need. You need documentation which is compelling. So fusion saves time for difficult cross-correlation cases. And here is just a still image showing that angiomyolipoma, because once you find it quickly with the ultrasound co-registration, then you can improve your window and sort of optimize it for the still image. Well, here's another case in which ultrasound co-registration saved us. A 60-year-old woman had 2 renal abscesses, had actually been followed by CTs multiple times, but the clinicians finally realized, gee, maybe we should reduce the patient's radiation exposure and follow this patient up with ultrasound. Well, one of my most experienced sonographers took the patient into a room, and what happened was he found one of the abscesses, but he couldn't find the other one. And he didn't use co-registration because he was pretty confident he was going to be able to find it. He's a very experienced sonographer. Well, he comes to me with this result, and I said, you know what, that's not good enough. We got to find both abscesses. So I sent him back and said, use the co-registration. And once he did that, he immediately knew he could find it. And so here it is. So the lateral abscess is yellow, medial abscess is red. We could definitely see both of them, okay? And then once we could see where we were, we could then optimize the image and look for and make a better picture for the report itself. So here's an example where co-registration, without it, we would have missed that second abscess and really looked silly. So here's an optimized image of the abscess, which we could not find once we knew where it was located by co-registration. All right, what are the disadvantages of ultrasound co-registration? Well, first of all, it's important that when it's set up, that it's compatible with whatever digital network or PACS you're using. And so therefore, before you have your vendor leave your department, make sure that it works. Make sure that the CTs and MRs readily download into the machine. Second of all, different vendor software options differ. And so depending on how you're going to use it, it's really important to demonstrate it, to use it in your department, at least for a short time, or look at it, because some types of co-registration are going to be better for interventional purposes and others are going to be better for diagnostic purposes. This particular feature does generally cost extra. It's an option. So, you have to decide whether it's worth the money for your department, but at least in our department, it really has been worthwhile. It does take some time to learn the software, and so just make sure that you have adequate training time set aside for your sonographers and radiologists so they feel comfortable using the technique. And then finally, depending on your circumstance, the CT or MR download time may take a while. In our department, it's not a problem to download a CT or MR most of the time, but during our very busy periods, it can take a few more minutes. And so what we tend to do is we preload our exams. If we know that a patient has a previous CT or MR, we just have that preloaded before the patient arrives. So in conclusion, there are many problems that we face in renal sonography. However, if we prioritize sonographer training and monitoring, if we realize methods that we can use to address problems such as non-visualization of the kidney or hydronephrosis, and then finally, if we're very careful about looking at our images so that we don't miss renal masses, then we can at least optimize the way that we look at the kidneys and reduce the number of lesions that we miss in those organs. So just like these pictures, as imagers, we pride ourselves on being able to spot differences in pictures, but sometimes the picture differences are very subtle. And so it's important as we go through our daily life and we see numerous pictures of the kidney that we look very carefully, as in these pictures, to spot any discrepancies that might give us a hint that something is wrong. Thank you.